My name is Jonathan Riley. I'm an assistant professor at the University of Buffalo and the director of functional neurosurgery for University of Buffalo Neurosurgery. Functional neurosurgery is the subspecialty that intentionally interacts with the nervous system for the therapeutic benefit of the patient. It turns out that we interact with patients with a broad variety of different problems, and so that means different things for different problems that patients come in with. We treat patients with either malignant or non-malignant forms of chronic pain. We treat patients with medically refractory epilepsy, and then we attempt to treat patients with medically refractory movement disorders or psychiatric disorders. We, as University of Buffalo and University of Buffalo Neurosurgery, are at this point where we are engaged in an extremely collaborative, team-based approach and are offering all of the contemporarily available state-of-the-art treatments. One of the really exciting things about the field is that it is ever evolving. There's really balanced innovation, which marries technology as well as our understanding of these different disease processes to meaningfully contribute to improvements in patient care.